Good morning, everyone, and welcome to the MIS webinar series. My name is Mindy Van Order, and I am the Marketing Coordinator and Renewal Specialist here at May Insurance Services. I'd like to thank everyone for joining us this beautiful morning. Today, our webinar will be on Dental for Individual, presented by Stephanie Mortensen, sorry about that, Stephanie, who is the Individual Product Consultant with Dental Care Plus, as well as Jackie Turner, the Individual MIS Marketing Director. Now, at this time, just a few housekeeping items before we get started. Everyone on the call is currently muted so that everyone will have a great audio experience. However, we do encourage questions as we're going along through the presentation. So if you do have a question that pops up as we're going along, please type that question in the chat box, the question box. It's located at the top right-hand side of your screen in that menu. I will be monitoring as we go along, and we'll get those questions answered for you. Looks like most people have logged on through their computer, so I won't be able to open the phone lines at the end. But again, any questions, please go ahead and type those into the question box. We will work on getting you a copy of this presentation over to you this afternoon. Stephanie, if you can send that to me, that would be great.
Absolutely.
And if you have questions, please feel free to reach out to Jackie, and you will be hearing from Jackie a little more at the end of the webinar today. So it looks like we've got just one more person currently in the process of getting signed in, so we'll give it one more minute or so, and then we will get started. So again, thank you everyone for joining us today. We'll get started shortly. Great, looks like everyone's in. Again, welcome to the MIS webinar series on Dental Care Plus's Dental for Individual. At this time, I'd like to turn it over to Stephanie. Good morning, Stephanie.
Good morning, Mindy. Thank you so much for having me today. We certainly appreciate May Insurance's partnership. You guys have been a great partner for a long time, and again, I appreciate you having me today. So my name is Stephanie Mortensen. Some of you that may be attending the webinar may know me as Stephanie Murray, but I got married in December, this past December, so I am now Mortensen, so just a heads up on that. And today I'm going to talk about our individual dental product. As Mindy mentioned, feel free to type in your questions in the chat box. I'm glad to answer those as I go along, and we'll go ahead and get started. Thank you. So today's agenda, I am going to talk a little bit about the Dental Care Plus Group as a company, for those of you that may not be familiar. And then I'm going to get into our individual product in detail. I will also go over how to enroll someone and then give you my manager's contact information, as well as myself and my counterpart, Jenny. So about Dental Care Plus Group, we were founded in 1986 by dentists. So we've been around for over 30 years. We focus on service for all entities, so we focus on our brokers, employers, providers, members, shareholders. Dental is all that we specialize in, so we are able to focus on having solid coverage that is priced fairly with flexible plan designs, and we also focus on provider access as well. We are continuing every day to grow our network. Right now, we have nearly 270,000 provider access points nationwide and continue to grow. We currently have a provider relations department that does a lot of recruiting. So if you do find that there is not a dentist in the network, then you can reach out to me and I will get that information over to our recruiting department, and they'll reach out to try to recruit that dentist. So today we have over 330,000 commercial dental lives. Some of our key accounts here, and I failed to mention, we are located and headquartered here in Cincinnati, Ohio. And we do have an office in Dublin, and then we also have an office in Louisville, Kentucky. So we are local. Some of our key accounts in this area are Butler County. A lot of the hospital chains have us, as well as some universities, as well as Cincinnati State, Xavier, the city of Kettering. A lot of our public schools and, again, hospitals in this area have us on the employer group side. So right now, this is what our offering looks like. For the vision, we have a Visus. Now that is only on the group side. We currently do not have an individual vision product, but I will go into some specifics about the vision discount program that comes with the individual product. But right now, a Visus is our vision provider on the group side. Then we have our commercial market. So here we have our group traditional group products. We have our EHB certified product and, of course, the individual product, which is what I will focus on today. And then we have our public market, which is exchange certified through Denta Trust and Denta Span. This map is a little bit outdated. We had an expansion strategy. Right now, the individual product is in Ohio, Kentucky, and Indiana, but we are spreading our group and our exchange product into some of these states that you see here. So I want to go over some information about the oral health and how it links to overall wellness. I think this little comic here is really cute. So the dentist is doing an exam on this individual and explaining that his heart and his lungs look good too, which going to the dentist is very key, especially for your preventive visits, because they can detect early signs of things like diabetes, kidney disease, and even heart disease. So the effects of poor dental hygiene, it can affect, again, it can cause heart disease, kidney disease, diabetes, periodontitis, which is gum disease, and also cause some preterm birth issues. So I think this statistic is very important to know. Half of Americans over the age of 30. So over half of Americans over the age of 30 years of age have periodontitis, some type of gum disease. So especially those that are working in the senior market, there's going to be, a good portion that possibly could have this gum disease. So it's important that they're going for their preventive visits. So over half of Americans, this equals approximately 64.7 million Americans. So with periodontitis, it's a condition in which gums pull away from the teeth and form pockets. These pockets that can get infected with bacterial toxins, and the body's enzymes fighting the infection start to break down the bone and the connective tissue that hold the teeth in place. If it's left untreated, the bones and the gums and connective tissue that support the teeth are destroyed. So some risk factors are smoking, hormonal changes in girls and women, stress, and medications. So you'll see the diagram here. A healthy gum is going to have 1 to 3 millimeters of space between the teeth and the gums. Then you see as you go up the scale here, you'll notice where there's infection that's starting, and that's when, again, that connective tissue can break away from the teeth, causing damage. With heart disease, the link with periodontitis and heart disease, individuals with gum disease can run a higher risk of a stroke. People with periodontal disease are almost twice as likely to have heart disease. This is from the American Academy of Periodontology. With preterm birth, pregnant women are more prone to gum disease due to hormonal changes, and women who suffer from gum disease while pregnant are 4 to 7 times more likely to deliver underweight and premature babies. So again, it's very important to get into the dentist twice a year to get those preventive visits in to detect some of these things early. I want to mention, I'm not saying to replace your primary care physician with your dentist, or the dentist replace, or not to have the dentist replace your primary care physician, but it is important that some things can be detected early by going to the preventive visits. With diabetes, it kind of runs both ways. So patients that are diagnosed with gum disease are at high risk for diabetes. And then you have, if someone's being treated for gum disease, it can help improve blood sugar. So that's a pretty significant link there. With kidney disease, it can cause, with kidney disease, a lot of times people have a compromised immune system, which makes them more susceptible to infections. So with that being said, periodontal disease can really, wreak havoc on someone's mouth that has kidney disease. Bone loss in the jaw can also happen due to prevention of proper calcium absorption as well if someone has kidney disease. So just real quick here, and then I want to get started on the individual product, but I thought it was important to give you some of this information to know how important it is to get into the dentist twice a year at least. So with individuals without dental benefits are more likely to have extractions and dentures, less likely to have restorative care, 67% more likely to have heart disease, 50% more likely to have osteoporosis, and 29% more likely to have diabetes. And I think it can go without saying that they are also less likely to visit the dentist as well. So they miss that opportunity for prevention and early treatment, causing quite a few visits, about 2 million visits to the emergency room for dental treatment. Now to get started on our individual dental plans, our plans were designed to fit every phase of life. So if you are working with single individuals, families, seniors, Medicare recipients, employees where the employer doesn't offer group dental, part-time employees, dependents that have aged off their parents' coverage. So these plans really were designed to fit everyone. The one thing that is missing from this list is children under the age of 18. One does have to be 18 to have their own policy with us. So with our plans, we have 3 types of services. So we have preventive, basic, and major. With our preventive services, there are no waiting periods. So starting the first day of coverage, they're able to receive their 2 routine exams and cleanings. Please note they can have that done twice a year at any time during the year. We do not make individuals wait 6 months in between their cleanings. So for example, if someone were to enroll into our plan for June 1st, technically between June 1st and December 31st, they are able to get their 2 cleanings because our benefits are based on calendar year, regardless of enrollment or effective date. Fluoride treatments, those are only available for 18 and younger. So if children are on the plan as a dependent, they can get fluoride treatments. We will cover 1 set of bite wing x-rays each calendar year, and we will cover 1 full mouth panoramic x-ray once every 3 years. Some of our competitors out there will cover the panoramic only once every 5. So we typically cover that more frequently. So with basic services, our basic services have a 6-month waiting period. However, I want to focus on what a basic service is with us because we do cover quite a bit. We cover fillings. We will cover a root canal under a basic service after 6 months. We will cover those periodontic procedures and maintenance procedures under basic services and repairs to crowns, bridges, and dentures. We will also cover extractions, simple tooth extractions. It's not listed there, but that's something else that we do cover. Major services have a 12-month waiting period, and that would be considered surgical extractions, such as getting the wisdom teeth removed, which my son has to get done on the 26th. So he's about to undergo that, so I can sympathize with that. Crowns, bridges, and complete and partial dentures. Now, I do want to explain with the crowns, bridges, and dentures, we have we will replace them every 5 years if needed. Our competitors out there will only replace them once every 8 years. So our time frequency is less, which is good. So as I'm mentioning waiting periods here, again, don't forget basic services. We cover quite a bit. The periodontics and the root canals especially. Some people mistake those for major services. Here we're considered basic. There is an opportunity, though, however, for individuals to have their waiting periods waived if they are transitioning from one of Dental Care Plus Group's group employer plans to an individual plan. So at this time, if you're working with someone that has had the Dental Care Plus group on their employer side and they transition to an individual plan, we will waive the waiting periods, and we give them 12 months versus 60 days with some competitors. So if, as long as there's less than a 12-month gap between when their group plan ended and their individual plan is effective, we will waive those waiting periods.
Stephanie, we do have a question that has come through, and that is in its regard to the coverages, and it's asking about implant coverage.
We do not have implant coverage. That's a very good question. So the question is, do we have implant coverage? And we do not have implant coverage at this time.
Thank you.
You're welcome. And, you know, a few reasons why. One being that implants are very expensive. We want to keep our rates affordable, and two, not everyone is a candidate for implants, believe it or not. So that's just something that we don't cover at this time, but that's not to say, you know, that may change in the future. So a product overview with our product. It is a simple web-based enrollment system. So one has the option to enroll online, and there is also now a paper application option. So with our web-based system, there is a personalized URL that I can build for you, that you can email to your clients, that you can put on your websites, that you can put on the signature of your email. I can build you a personalized link that how it works is it embeds your national producer number into the application. So I'll get into that a little bit later. There are 4 plan options. Our rates are based on age, so 54 and under, 55 and over. They do have to be 18 to have their own policy, and there is no age maximum. Our rates are reviewed annually. Currently, they're adjusted for October, but we are in the works of trying to get them adjusted for January, so we're on the same calendar as everyone else with our increases, or whether, well, I should say if they increase. And again, currently we're available in Ohio, Kentucky, and Indiana. And if someone enrolls and chooses electronic communications, they will have access to a member portal where they are able to print their cards, view their benefits, change their payment method, everything that they need to do to maintain their plan. It is a monthly premium payment, so we will automatically draft on a monthly basis the premium. The commission is 10% for every month. So the commission that you get is 10% monthly for every premium that comes in the door. The choices of Visa, MasterCard, Discover, and electronic check, and also savings. We did add savings. So we, again, as I mentioned, have a paper application. So this should help with the senior market clients who do not have access to a computer. I do want to mention that with our plans, one has to enroll by the 15th of the month to get the next month's effective date. So again, by the 15th of the month to get the first month's effective date. So right now we are in a June 1st effective date, being the soonest one available. So in the Ohio service area, you'll see there in the bottom left-hand corner of Ohio, there are 4 counties that are orange and the rest of the state is green. So product availability is determined by the zip code of your client. So if someone in Franklin County wants to enroll, they are eligible for the PPO. If someone in Butler, Claremont, Hamilton, and Warren County wants to enroll, they are eligible for the HMO. Someone in those HMO counties cannot have the PPO and vice versa. So in your area there, in the Columbus area, that's the PPO product. Now, the HMO service area, that is our Dental Care Plus network. We have 96% of the dentists in the greater Cincinnati, Northern Kentucky region in this network. And then with the PPO service area, we have our own network, and we also lease the DentaMax network. And again, it's growing daily. If you come across someone who is in a PPO, however, they do not want to access those out-of-network benefits, they want to remain in network, I'm glad to have our provider relations department reach out to that dentist for recruitment. So the moment we've all been waiting for, this is our product overview here. Again, we have 4 plan options. We have the age categories of 54 and under, 55 and over. And then we have 4 tiers. You'll see it's the top left, individual, individual plus spouse, individual plus children, and family. 2 things that are consistent across the board with the 4 plans that we offer. One is there's a one-time annual $50 deductible per member or $150 per family. So if you have a family of 3, they each have a $50 deductible up to $150 a year. An individual and spouse has a $50 per member deductible. The second thing that is consistent is there is a $10 copay for preventive visits. So on Plan 1, you'll notice that on preventive exams and cleanings, we will pay 100% after a $10 copay. Now, this is our HMO. So they do have to stay within the network if you're working with someone in Butler, Claremont, Warren, or Hamilton counties. In 6 months, they receive their basic services at 50%. Their annual maximum benefit is $1,000. There are no major services covered here. The annual maximum benefit is per person. It doesn't state that here, but it is per person. So everyone gets their own maximum. No one wants to share. So, you can see someone 55 and over, $25.23 per month. That's shy of $300 a year or a little bit more. And it pays for itself in the preventive side alone. And then in 6 months, they get that 50% coverage for basic services, which don't forget we cover quite a bit. The fillings, extractions, root canals, and perio maintenance and procedures for gum disease. When you look at Plan 2, Plan 2 is popular for those that are concerned with the high cost associated with dental procedures. You'll notice it has a $2,000 maximum, which is popular. I do want to mention, however, though, it does pay 60% for major services, which is the highest out of the 4 plans that we offer. It covers 60% for basic services, and it covers 60% for the preventive. So the trade-off is going to be that in order to have the higher payout on major services and that high payout on the maximum, the exchange is you will have to contribute 40% to your preventive services. Plan 3 and 4 are popular for those that are used to group benefits. They're used to that 150/50 or that 180/50. An important thing that I do want to note that if you are getting a pushback from the waiting periods, one can start with Plan 1 for their first year. If they start with Plan 1 for their first year, that is absolutely a great starting point because they're going to get their money's worth in the preventive side. And then at their renewal, if they would like to, they can upgrade. If they upgrade, even though Plan 1 doesn't have major services, we will count the 12 months that they have been with us towards those waiting periods, and the waiting periods will not start over. So yes, Plan 1 is a good starting point, and when they can upgrade at renewal, they do not start over on waiting periods. So let me reiterate, our benefits are calendar year, but the renewal is anniversary. So someone who enrolls for June 1st, they have to enroll by May 15th. They receive their benefits starting January 1st. They have a clean slate. And then by May 15th of the following year, they can decide to change their plan, and those plan changes will take effect June 1st. Here's our PPO. So this is primarily what you would sell in the Columbus area. Same plans, same exact plans, except for the pricing is different, and there's an out-of-network option. So you'll notice that they are lower in premium, actually, $23.37 versus $25.23 for an individual on Plan 1. And there is a 10% differential if one wants to go out of their network. So again, same plans, same plan designs, except different pricing, and they have that out-of-network benefit. So with that, I will let you know that we will pay, for example, on Plan 1, out-of-network, we will pay 90%, and it's not based on UCR. It's based on a fee schedule, and the fee schedules are based on the demographics of the dentist, such as the region, the specialty, the benefit plan, and the provider. So it's going to be different from each area. So a dentist in New York, we're going to reimburse different than a dentist in Florida. So it's based on demographics. Our Kentucky service area, our HMO service area is Boone, Campbell, Kenton, and Pendleton. And then we have the rest of the state, which is our PPO. The Boone, Campbell, Kenton, and Pendleton area, that includes our Dental Care Plus network that has 96% of the dentists in the greater Cincinnati, Northern Kentucky region. And then for Kentucky, the PPO is our own network that wraps around CenterCare. Same plans, different pricing. So same concept applies. Our Kentucky PPO mirrors our Ohio PPO with the opportunity to go out of network. It's just different pricing. And then we have the state of Indiana. There are no HMO products available in the state of Indiana. The whole state is a PPO. Again, same plans, different pricing. So the Dental Care Plus Group individual product difference there, again, I can build you a personalized URL that ensures that you receive credit for your sales. When you enroll someone or someone clicks on your link, it could be midnight and you could be selling a dental policy and not even know it. If someone clicks on your link and enrolls, you will receive a real-time secure email notification of the sale, which includes the name, the premium, the plan, their ID number, all of the information that you need to know. Again, it is a monthly premium payment. We will deduct the first month's premium at the time of enrollment, and then all subsequent payments will be on the 19th of each month. So if someone enrolls today for June 1st, we will take June's premium today, and then June 19th will pay for July. July 19th will pay for August. Again, 10% commission. It doesn't decrease over time. It is for the life of the policy. And one thing among many that we pride ourselves on here at Dental Care Plus is that we have a live receptionist and customer service during business hours. If your clients give us a call, they will receive a receptionist that answers the phone to get them in the right place, which is unheard of these days. But our receptionists are wonderful, and during the business hours of 8 to 4:30, again, if they call in, they're going to get a live person, live customer service. Our HMO network, as I mentioned, is 90. It's now 96 of all general dentists. Percent of the general dentists are in our network, and then the PPO includes nearly 270,000 access points. Our plans include and come with, even our Plan 1, a vision and hearing discount program. These are great discount programs. They come at no additional cost. Don't forget the perio and endo are covered under basic services and not major. If someone does need periodontic maintenance or procedure, or that maintenance, so you may have heard the term deep cleaning. A lot of people that say, I need a deep cleaning, I have to go for deep cleanings, what they mean is that is a perio issue. They go for perio maintenance. So in addition to their 2 preventive cleanings, they can get the 2 additional perio cleanings under the basic services. No 6-month wait between cleanings. I mentioned crown denture bridge replacement every 5 years, and we do have 4th quarter deductible carryover. So if anyone pays out their $50 deductible or a portion of their $50 deductible in the last quarter of the year, we will let them carry that into the next year. So, it's November, someone's getting a root canal, they pay their $50 deductible. In January, they get that crown put on. They don't have to pay the deductible again. So that's nice. A lot of this stuff I've gone over. I apologize, I'm being a little bit repetitive here, but they have to be 18 to enroll. Dependents. So dependents can be on their parents' plan up to age 19 in Ohio, 25 in Kentucky, and 26 in Indiana. We are looking into making that consistent at 26, but at this time, that's what the numbers are, or the ages. So if they do have someone that's turning 19, and what they can do is they can turn around and purchase their own individual plan, and their waiting periods are waived. So they don't have to start back over on those waiting periods. So, we at least give them that. And the first of the month is always the effective date. They must enroll by the 15th. One can enroll up to 3 months prior to the effective date. So if it's October and you're working with AEP clients and they want to enroll for January 1st, they're more than welcome to. Our paper application is on our website, which I'm going to jump on here and give you guys an example of how to enroll someone. Renewals or anniversary. So anyone that enrolls into a plan can cancel at any time. So our cancellation policy is you can cancel at any time, but if you do, you are blacked out for 25 months before you can come back. And that is to prevent individuals from enrolling, getting things done, disenrolling, and continuing that process. It would increase our rates, and we want to make sure these remain affordable. Okay, so these are slides about how to enroll. Yeah.
Stephanie, I'm sorry. Could you go back to that slide? You talked about children. Now, can you just have kids on the policy if one of the kids is age 18? And the rest are like 12, 11, that kind of thing? Is that possible to do it that way?
Okay. For the 18-year-old to have their own, or to be on the plan with the parents?
On the plan with, well, I'm talking about just kids. Can you just have the kids on one plan without the parents? If one of the kids is like 18, I guess. Okay. No.
Oh, no. They do have to have a dependent, or they do have to have their parents or their guardians on the plan with the kids.
All right. Okay. Thank you.
You're welcome. Good question. Okay, so I am going to do my best to transition here. Can you see our website?
Yes, we can.
Okay, perfect. Thank you so much. So this is what our website looks like. So when you have your personalized URL, and if you want me to build a personalized URL for you, all you have to do is reach out to, I believe Miriam is the one that collects the agent data sheets. So if you get an agent, yeah, okay. So if you get an agent data sheet from her, she will send it to me once it's completed, and that will start the process on me being able to build your personalized URL. So when you click on your URL, this is our website. The difference is here in the web address bar, you will see your national producer number. That's how you'll know it will be embedded into the application. So we have here about us, our plans, frequently asked questions, and this is how someone would find a dentist. So if I click on find a dentist, you would choose HMO or PPO, depending on which one your client is eligible for. And then you can search by zip code, county, the last name, specialty. This is a really user-friendly provider search here. So if the dentist appears, then they are considered in network. So I'm just going to do a little fake enrollment here. So it's 4 easy steps to enroll. Even though you've quoted them, they still need to go to this box and enter in this information in order to enroll. So you have your zip code, your tiers, age category, and effective dates. Click on Get Your Free Quote. Here are the 4 plan options. Now, if you click on this Summary of Covered Services document, this document is very, very helpful. I just went over, some basic information on the services provided, but this document breaks down what we consider preventive, basic, and major, and our, the time. So, here it says limited 2 visits each year, the cleaning 2 each year, etc. So that will give you the time references on when services can be performed or how often. So if I want to enroll online, I'm going to click Enroll Online. But if I want a paper application because I don't want to do an online application, you can click here to get our paper application. Okay. So if someone would rather, enroll via paper, they can. But I'm going to go ahead and click Enroll Online. But this is where you would find the paper app. Accept the terms and conditions. And this is the first page of the application. So 4 steps to enroll. Here is the first page. This is where we ask for all of their demographic information, their email address. If they don't have an email address, please don't use your email address because there's only 1 email address that can be used per account. So if just do your best to use their email address, and if they don't have an email, then you would want to resort to the paper application. Here is where we ask if they've had prior coverage with us. If you say yes, then that puts in then we need their prior member number. If you don't have that, I'm happy to give that to you. Some people just throw away their cards, which I'm guilty of as well. So there's no problem getting that number if need be. If it's 6 o'clock in the evening and you're enrolling someone who's had prior coverage with us and you can't get past this point, go ahead and enroll them. Just send me an email. Joe Smith had prior coverage. I wasn't able to obtain the prior member number. We can always fix it in the end. So that is the first page. And here's the last page. This is where they will put in their payment information. So they can choose credit card, electronic check, and they can choose a business checking or savings as well if they're doing an electronic check. This is where your broker code goes. So by using your personal URL, your broker code will automatically embed into the application. If you are at someone's house and they want to enroll and you don't have your link handy, you can still go to our main website, mydentalcareplus.com. Just enter in your broker code manually, your national producer number. If you enroll someone and you don't know your national producer number, go ahead and move forward with the enrollment. Shoot me an email. Explain that you're the agent of record, and we are happy to get it fixed for you. Okay, we're very flexible. Then you have the math problem, which is the security question. This is new. One can receive communications by email or by mail. So if they choose mail, we will send their packet to them within 7 to 10 business days. If they choose email, we will email them an email confirmation with a username and password where they can log in and print their ID cards. And then this is where they put in their electronic signature. They would then hit checkout. This button will be green, and that's it. So 4 steps to enroll. Enter the information for a quote, choose the plan, and a 2-page application. Very user-friendly. Oops. Here we go. So these slides just explain how to enroll. I like doing it on the internet so you can actually see the process. If someone chooses email communications, this is what the email looks like that they receive. So they receive their login, which is their email address. That's why we prefer them to use their email address. And they receive a temporary password where they can log in and register. This is just a picture of someone registering, making up their own password, and answering some security questions. And then after that, they have the capability of printing their card, viewing their application, and printing their contract as well. Are there any questions for me? I appreciate everyone hanging in there with me today. I know it's a lot of information. I try to go through it because I know your time is valuable. If I went too fast or you have questions about anything, feel free to ask, or if you think of it later, here's my contact information. My information's in the middle, my direct line and my email. Feel free to reach out to me. So thank you so much. I'll turn it back over to Mindy. And I appreciate your time today.
Thank you, Stephanie. We do have one question come through, and that is on that personalized URL. Can that be added to an agency's website?
Absolutely. Absolutely. And if that's something that you're interested in doing, if you're putting your personalized URL on your website, or say you want to do a Facebook page or anything on social media, let me know and I can give you some really short, quick talking points that you can add with that personalized URL that are really helpful and they look really nice.
Great, thank you. One other question is, if I happen to be registered to sell Dental Care Plus for group, is it a separate appointment for Dental Care Plus for individual?
It is not. So if you're appointed on the group side, you do not have to reappoint on the individual side. If you are not appointed at all, that's okay. Still reach out to Miriam to complete that agent data sheet. Once you sell your first case, we will complete the appointment process once you sell your first case. We're able to see when you do that.
Okay, great. And I just wanted to clarify something. I know many of you on the call probably have heard that Miriam is no longer with us, and that is true. However,
I'm sorry.
No, you didn't know. Okay, we are still using her email address as all the contacts for the individual information for licensing and stuff. So please continue to use Miriam's email address until we are able to get a new person in there and get them up and running. Somebody, Dave Lynn here at our office is constantly monitoring that Miriam email box. So send it to Miriam and we will get it taken care of for you. At this point, I don't see any other questions. Jackie, did you have anything?
Yeah, I just wanted to thank everyone for being on the webinar. I know everyone is busy, but again, I want to thank everyone. If you have any questions, you can call me directly. Everyone has my number or my email address. Just want to thank everyone for being here. Have a nice day and happy selling.
Thank you. Have a nice day, everyone.
Thank you. And remember, I will be sending this presentation out to everyone on their emails later today. Look for it. Any questions, please give Jackie and or Stephanie a call. Thank you.
All right. Thank you. Bye.
Bye-bye.